Hello friends and welcome back to the channel. In today's video, we'll be discussing how to prepare for your clinical rotations. If you're new here, hi, my name is Christina. I'm a fifth year medical student and I'm passionate about helping you thrive in medical school. So if you want to join the family, feel free to hit the subscribe button down below or follow me on any of my social medias. I'm on TikTok and Instagram. As you know, clinical rotations can be really exciting but also really intimidating. But if you take a few moments to prepare, it makes the world of a difference. So let's get into the video. The first step in preparing for your rotation is researching your rotation sites. Check the hospital or clinic's website, research the specialties, and familiarize yourself with the hospital locations. There's nothing worse than not knowing where the hospital is, leaving it for the last day or the last minute, and then arriving late to your first clinic. You can also reach out to upper years who have done this rotation to find out a little bit of information about the hospital. Maybe they know really good study spots nearby, or they can just give really good tips and tricks about doing your rotation at that specific hospital. Next is know what to wear. It's really important that we contact the school or the lecturer to find out what the appropriate attire is. Some hospital rotations require you to wear their scrubs, some want you to bring your own scrubs, others are fine with just your white lab coat. However, some rotations, like a GP practice, prefer you to be in work professional attire. So it all depends on where you're going, what those specifications are. So it's really important that you contact them ahead of time so that you don't show up in jeans and a t-shirt and everyone else is in scrubs. Another thing is to make sure that you're wearing comfortable shoes. Whether it's in work professional attire or if you're in your scrubs, you will be on your feet for majority of the day, so make sure that you are prioritizing comfort as well as wearing compression socks. We really want to be looking after our vein health. Next is practicing professionalism and empathy. Remember, you're going to be working in a professional setting with sick patients and their families. It is highly important that you practice as if you were a doctor yourself. Always introduce yourself and explain the purpose of your visit. Don't just stand in the corner staring at your patients. It would probably make them very uncomfortable. If it were you and there was a random person standing in the corner of their appointment, you'd also feel uncomfortable too. So make sure you introduce yourself. It could be something as simple as, hi, my name is Christina. I am a fifth year medical student and I'll be observing the consultation today. Simple and sweet. Listen attentively and show genuine interest when your doctor or nurse or preceptor is communicating with the patient. You don't want to be sitting there scrolling on your phone, not interested at all, because that just shows a lack of professionalism, as well as these are people who have genuine lives and concerns. We want to show empathy and respect towards every single patient. One more thing is to maintain confidentiality. Remember, there are HIPAA laws, so don't take pictures that give away information. Always ask for consent, especially if you're on your OBGYN rotation and you've delivered a baby. If the mother allows you to take pictures with that baby, please ask for consent, and if possible, cover the baby's face with an emoji or a text or something so that you're not giving away the patient's identity. And please do not take pictures of any medical records that have the patient's identifying numbers or factors on them. Next is to focus on building a relationship with your preceptors and your colleagues. Building a relationship with the people who work at the hospital, as well as the people you're doing your rotation with, can only benefit you. Not only does it enhance your clinical rotation experience, but it also helps improve your teamwork and communication skills. My tip is make best friends with the nurses. They know exactly what's happening in that hospital. They run the hospital, and if you ever need anything, the nurses are the ones that are going to have your back. So make friends with them. Find the matron and become her grandchild. Simple. Be proactive in introducing yourself and expressing your willingness to learn from them. There's nothing worse than a student who just is not interested in the rotation and doesn't really want to be there. The doctors and the nurses are not going to teach you if you don't want to be taught. And I would highly suggest, if the doctors are busy, going to the nurses, if they have time, asking them to show you some clinical skills, because they have really good tips and tricks up their sleeves. Also be sure to seek feedback on your performance as well as guidance if you need it. These are professionals who have been working in the game for a very long time, so they'll be able to help guide you in the correct direction. And remember, criticism is good. It helps us learn and grow. Baby little medical students, we still have years to learn from. So take that criticism and work on it. Also make an effort to connect with your fellow peers, because they're going to help you through those rotations. Rotations can get really hard, really intense. There's a lot of coursework to study on top of being at the hospital all day. It's really important that you do establish a good friendship group. Next is to take care of yourself. It is crucial to take care of yourself during your rotations. As I previously mentioned, clinical rotations can be physically demanding as well as emotionally draining. Remember, not only are we on our feet for most of the day and then studying at night, but we're also dealing with real patients and real lives. So that can have an emotional toll. Sometimes there are very sick patients that present. It can be emotionally draining. Make sure to prioritize self-care like exercise, meditation, and make sure you're getting adequate amounts of sleep. And don't forget to prioritize nutritious meals. You don't feel your body is not going to run, so you need to make sure that you're looking after you, because if you don't look after you, then how are you going to look after your patients? Next is be open to learning opportunities. Clinical rotations are essential to learning and growing as a medical student. You get to finally apply what you've learned in your preclinical years in actual clinical context. And so much of the time, things just snap into place and you're like, oh my gosh, that makes so much sense. Definitely become a sponge and soak up all the knowledge that is going to be provided to you on your clinical rotations. Be open to learning opportunities such as observing surgeries, attending lectures, or participating in research projects. Find out from your preceptors and your colleagues what is happening in the hospital and see if you can get involved. 9 times out of 10, if you ask a doctor to scrub in on a surgery, help them in their research project, they will most likely be ecstatic at the opportunity to get you involved. Make sure you take advantage of these opportunities and expand your knowledge and skills. If you want more information on my hospital essentials, such as what to bring to your rotations to make sure that your day at the hospital is smooth and stress-free, then comment down below and I'll make that video. If you don't want to wait, I did make a similar video on TikTok that I'll link down below, and you're more than welcome to see what my hospital essentials are. That's it for today's video on how to prepare for clinical rotations. Remember to research your rotation sites, practice professionalism and empathy, know what to wear, brush up on your medical knowledge, and be open to learning opportunities. See you in the next video. Bye friends!